Consciousness can be altered in a number of different ways, and we are going to focus here on how consciousness can be altered through hypnosis, meditation, and biofeedback. Hypnosis is an altered state of consciousness where people become more suggestible and behave as though they are in a trance. There's been many psychological studies of hypnosis, and at first it wasn't clear whether hypnosis was a true phenomena or it was just individuals that were behaving strangely because they were highly suggestible. Relatively recent studies have shown, however, that hypnosis can be used successfully pharmacologically in a therapeutic setting as well as psychologically. It can be used in medical procedure to decrease the amount of sedation that individual needs. It can be used to help individuals who suffer from debilitating chronic pain, and it reduces the amount of pain. It can be helped psychologically in individuals who, for example, are trying to stop using a particular substance, such as nicotine and cigarette smoking. So it has been found relatively highly successful in these different types of setting. The exact nature, though, and mechanism of hypnosis is still unclear. Meditation is another way in which we can alter consciousness, and this is done by focusing the consciousness, remember the current activity of our brain, whatever it is that we are currently thinking of is our consciousness. So we are focusing our consciousness, and typically in transcendental meditation, which is more related to religion, we concentrate on mantras, while in mindfulness meditation, which is the type of meditation that we most often use in the Western world and in a therapeutic setting, we focus on the present instead of ruminate and think about problems. So, for example, one of the typical technique of mindfulness meditation is to focus on the breathing. So you will focus your thoughts on your breathing of air in and out of your lungs, and you will stop focusing on the problems, which will decrease in many different situations the stress response, which is a very positive event. Biofeedback is another system that provides this information about the functioning of the autonomic nervous system, in particular the sympathetic nervous system. Remember, sympathetic nervous system, the system becomes active when we are in a stressful situation, when we need to become ready for action, either to fight or flight or run away. Now, because the autonomic nervous system functions automatically, we have no way of knowing when the system is active or not. Now, biofeedback is some sort of machine that provides a feedback, typically an acoustic, an audio signal on the functioning of this autonomic nervous system. And it can be useful in fighting stress, tension, and anxiety. When we engage in particular behavior that increase the activity of the sympathetic nervous system, whenever we can hear a tone that alerts us that that system is active, we can become aware of particular behavior that are maladaptive for us, particular behavior that are going to increase the activity of the sympathetic nervous system, and learn to avoid this type of behavior. Now, another way in which consciousness can be altered is through drugs. I'm not talking about just illegal drugs, but any drugs that is psychoactive can alter consciousness. So ranging from caffeine, something that anybody can have access to, is widely available in our Western world, right? Not only through coffee, but also now present in some drinks that anybody can buy at the drugstore. So ranging from that basic substance that anybody can buy, going on through nicotine, which is controlled, alcohol is another substance that is psychoactive, moving on to illegal drugs, recreational drugs, such as marijuana, amphetamines, heroin, for example. And all of these drugs, again, are related because they are called psychoactive. They have the possibility of acting on our consciousness. Now, there's a common element of all of these psychoactive drugs, is that the vast majority of them could lead to substance abuse, dependence, and the development of tolerance and withdrawal symptoms. Substance abuse is defined as repeated use despite impaired functioning. An individual can have, let's say, a cup of coffee, and that would simply be substance use. However, if someone drinks 5 bottles of Red Bull, probably their behavior is going to become impaired as a result of that action, and so that would be an abuse. So someone who drinks too much, for example, have too much alcohol, they could abuse it. After repeated abuse, an individual could become dependent on that particular psychoactive drug, which is characterized by a loss of control over the substance, meaning that the individual will seek out that substance repeatedly and with disregard of other priority in their lives, such as their family, their friends, their work, their academic career, and will focus solely on, or mostly on, obtaining and using that particular drug. So it organizes one's life around getting and using the substance. Substance dependence then also lead to tolerance, which is a decreased reaction to the drug. So after repeated use, let's say if a cup of coffee initially led to a very strong effect, after repeated use that cup of coffee doesn't have any effects anymore, and you need 2 or 3 cups in order to obtain the same effect. Now this is true for caffeine, it's true for nicotine, alcohol, as well as illegal drugs such as amphetamines, cocaine, heroin. Another common outcome of substance dependence is withdrawal symptoms, which occurs in the absence of that particular psychoactive drugs. Once an individual becomes dependent on that particular psychoactive drug. Without the drug, particular effects will occur in that individual that could range from tremors, fever, stomach cramps, vomiting, diarrhea, and even death. Alcohol is the most abused drug, and it is estimated that 10 to 20 million Americans are alcoholics. Half of all Americans use alcohol regularly, so it's a huge number. And an astonishing statistic is that about 4 college students die every day from alcohol-related causes. So this is typically the result of binge drinking. This behavior that occurs especially in young adults, where individuals get together and they drink as much as they can, and that can cause serious harm, including alcohol poisoning, which is one cause of possible death associated with alcohol. Alcohol is a depressant in a sense that it slows the activity of the central nervous system. Individuals that use and abuse alcohol has an effect where the normal inhibiting circuitry of the brain become depressed, so that their inhibition are taken away. So normally we have this inhibiting mechanism that prevents us from behaving in socially inappropriate ways. But when we use and abuse alcohol, this depression, this slowdown of activity of this sort of inhibiting mechanism occurs. So it's a double negative in a way. You take away the brakes that normally are part of our brain that prevents us from behaving a certain way, and all of a sudden individuals begin to behave in inappropriate ways, as sometimes individuals who are drunk engage in. So there's a lot of inhibition, as well as impairment in cognitive functioning and coordination, increased reaction time, and that leads to very serious problems if you think of an individual, for example, driving. The inhibition are lowered, the cognitive functioning and coordination are impaired. That is a recipe for disaster. Opiates are highly addictive group of narcotics derived from the opium poppy. They include morphine, heroin, codeine, Demerol, hydrocodone, and so on. Major application is pain relief. Very good substances to relieve pain that occurs in individual, in many different situations. But we're talking about very severe pain. So individuals who suffer from terminal cancer, for example, can benefit from this type of pain relief. Now, another effect, though, aside from pain relief, is that they provide type of substances a strong euphoric rush, so they make an individual feel good, and that is the most addictive part of opiates. And even a single use can lead to dependence. Amphetamines and other psychoactive drugs that increase the activity of the central nervous system, taken in high doses, can produce a euphoric feeling, a sensation of well-being, because of the increased activity of a stimulant activity of the central nervous system. It can cause insomnia and restlessness, and severe cases can lead to psychotic symptoms and crash upon withdrawal. Whenever an individual have taken high doses of amphetamines, when those effects of the amphetamines end, the individual immediately will crash and feel withdrawal symptoms. Tolerance develops quickly, and user might become dependent relatively quickly as well. Ritalin, interestingly enough, is a common treatment for hyperactive children, and it is a type of amphetamine. Now, why would we use an amphetamine, a stimulant, to treat individuals with a hyperactive disorder? The answer to that is that what appears to be missing in these individuals with hyperactivity related disorder is the functioning of those inhibiting mechanisms that I mentioned before. Now, with Ritalin, those inhibiting mechanisms are stimulated, and therefore you're stimulating the brakes of the brain and you calm the individual down. So sometimes the brain can be affected in very interesting way. Cocaine is another stimulant that produces a euphoric feeling, so again it's very addictive. The physical danger of it is a sudden rise in blood pressure and decreased oxygen to the heart, and this can cause an overdose, this can cause an overdose as a result of the sudden rise in blood pressure and decreased oxygen supply to the heart, which leads to suffocation. So an overdose can typically, as a result of cocaine, result in an individual stopping their breathing and possibly suffocating. It can cause restlessness because it's a stimulant, insomnia, again similar to amphetamines, tremors, headaches, nausea, convulsion, hallucination, delusion, and finally, again, as a major cause of death as a result of cocaine overuse is cardiorespiratory collapse. Nicotine, very addictive stimulant in tobacco smoke, creates this psychological dependence on tobacco. It appears to reduce stress and it appears to calm an individual down, but again, in reality, nicotine is a stimulant and it depresses appetite, so it stimulates really the activity in part of the sympathetic nervous system. Remember, the sympathetic nervous system, when activated, shuts down the activity of the digestive system, and therefore the digestive system shuts down, the individual is now hungry, and it therefore decreases this appetite. Marijuana is classified as a hallucinogenic drug, where the active ingredient of it is THC, may produce relaxation, heightened and distorted perception. The big controversy of, as you're probably aware, the use of marijuana pharmaceutically to treat particular disorders. As you know, in Massachusetts, had recently been approved as a possible pharmacological agent. It impairs perceptual and motor coordination. It has a particularly strong effect on short-term memory, and therefore it slows down learning. Now, learning and memory are closely related to each other. If you impair the immediate short-term memory, learning is going to be affected. And another effect of marijuana is that it elevates the heart rate. Finally, LSD, or lysergic acid, is a hallucinogenic drug produced in a laboratory. It leads to this vivid, colorful hallucination. An interesting aspect of LSD and other hallucinogenic drugs that they can possibly lead to flashbacks, which are re-experiencing the high of the drug, days, weeks, sometimes even months after the drug was used. This is possibly because the substance becomes stuck in the cerebrospinal fluid of a spinal cord, and then at a later time it is released in the cerebrospinal fluid and travels to the brain, and it becomes effective again. We have a number of other hallucinogenic drugs, including mescaline and PCP.